My physical and mental health is at risk, as I increasingly feel tired, low in spirits, irritable, and wake up exhausted with no desire to get out of bed. Your alertness is at risk, on the verge of anxiety and other serious consequences like diabetes and depression. Here are the details. In our physical health, our body changes drastically. The relationship between chronic sleep deprivation, daytime sleepiness, and the increased risk of diseases is based on a series of physiological mechanisms and biological processes that affect the human body. Here is medical information on how this association occurs. 1. Disruption of the endocrine and hormonal system. Lack of sleep can affect the regulation of various hormones in the body, including insulin, which regulates blood sugar, ghrelin, which regulates hunger, and leptin, which regulates satiety. Insufficient sleep can lead to insulin resistance and an increase in ghrelin levels, which stimulates appetite, and a decrease in leptin levels, which suppresses appetite, leading to weight gain and the development of obesity and type 2 diabetes. 2. Inflammation and oxidative stress. Chronic sleep deprivation can trigger an inflammatory response in the body and increase oxidative stress, which are risk factors for the development of cardiovascular diseases such as heart disease and stroke. Chronic inflammation and oxidative stress can damage blood vessels, increase blood pressure, and contribute to the development of atherosclerosis, plaque buildup in the arteries. 3. Alterations in glucose metabolism. Lack of sleep can affect the body's ability to regulate blood glucose levels, increasing the risk of insulin resistance and type 2 diabetes. Insulin resistance prevents cells from effectively using glucose as an energy source, resulting in elevated blood sugar levels and, over time, can lead to diabetes. 4. Impact on the immune system. Sleep plays a crucial role in the functioning of the immune system. Chronic sleep deprivation can suppress immune system activity and increase susceptibility to infections and diseases. Additionally, chronic inflammation associated with lack of sleep can contribute to the development of autoimmune diseases and inflammatory disorders. In summary, chronic sleep deprivation and daytime sleepiness can increase the risk of developing a variety of health problems, including heart diseases, type 2 diabetes, obesity, and metabolic disorders, due to a series of physiological mechanisms that affect the human body. It is important to prioritize adequate sleep and adopt healthy sleep habits to reduce the risk of these diseases and promote overall health. If you experience chronic sleep problems or symptoms of daytime sleepiness, it is important to seek medical guidance to assess and address any underlying sleep disorders. In my severely affected mental health due to sleep disorders, it is a path of no return to serious illnesses like depression. We are on time, but let's learn how this happens. At the medical level, the relationship between sleep disorders, such as insomnia, and anxiety and depression can be explained through various physiological and neurobiological mechanisms. Here is a detailed explanation of what happens within our brains, from chemical hormonal details to daily manifestations. 1. Dysregulation of the autonomic nervous system. Sleep disorders, like insomnia, can trigger chronic activation of the autonomic nervous system, which regulates bodily functions such as heart rate, blood pressure, and breathing. This chronic activation can lead to excessive alertness and a persistent stress response, which can contribute to the development of anxiety. 2. Dysregulation of neurotransmitters. Sleep disorders can affect neurotransmitter levels in the brain, including serotonin, dopamine, and gamma-aminobutyric acid, GABA, which play a key role in mood regulation and anxiety. Decreased availability of these neurotransmitters due to lack of sleep can contribute to the development of anxiety and depression. 3. Dysfunction of the hypothalamic-pituitary-adrenal (HPA) axis. Chronic sleep deprivation can affect the function of the HPA axis, which regulates the body's response to stress. Excessive activation of the HPA axis can lead to elevated levels of cortisol, the stress hormone, which has been associated with the development of anxiety and depression disorders. 4. Systemic inflammation. Lack of sleep can trigger an inflammatory response in the body, characterized by an increase in pro-inflammatory cytokine levels. This systemic inflammation can contribute to the development of mood disorders, such as anxiety and depression. 5. Alterations in brain plasticity. Sleep plays a crucial role in brain plasticity, the brain's ability to adapt and change in response to new experiences and learning. Chronic sleep deprivation can affect brain plasticity, which can influence cognitive and emotional function and increase the risk of mood disorders. In summary, sleep disorders can trigger a series of physiological and neurobiological changes that can contribute to the development of anxiety and depression. These changes may include dysregulation of the autonomic nervous system, dysregulation of neurotransmitters, dysfunction of the hypothalamic pituitary adrenal axis, systemic inflammation, and alterations in brain plasticity. It is important to address both sleep disorders and mental health problems comprehensively to promote overall health and well-being. If you experience symptoms of anxiety, depression, or sleep disorders, it is important to seek medical help for proper diagnosis and treatment. We usually start getting used to things as normal in our daily lives, and therein lies the danger. Let's delve into how insufficient sleep can affect memory and concentration. 1. Information processing. During sleep, especially during deep and REM, rapid eye movement, sleep stages, the brain processes and consolidates information received during the day. This means that the brain organizes and stores information in long-term memory more effectively. When sleep is inadequate, this process can be interrupted, making it difficult to retain new information and recall what has been learned. 2. Memory consolidation. Lack of sleep can affect the brain's ability to consolidate memory, that is, to convert temporary information into lasting memories. This consolidation is crucial for learning and long-term retention. When sleep is insufficient, memory consolidation is compromised, leading to difficulties in remembering important details, past events, or acquired knowledge. 3. Cognitive function. Sleep plays a fundamental role in cognitive function, which includes processes such as attention, concentration, problem-solving, and decision-making. Sleep deprivation can negatively affect these processes, resulting in difficulties concentrating on specific tasks, maintaining attention for prolonged periods, and thinking clearly. 4. Learning and academic performance. Students who do not get enough sleep may experience difficulties in learning and academic performance due to memory and concentration problems. Lack of sleep can affect the ability to absorb new information, understand complex concepts, and perform well in evaluations and exams. 5. Impact on work and productivity. In the workplace, lack of sleep can have negative consequences for productivity and job performance. Individuals may experience difficulties in completing tasks on time, making errors more frequently, and having trouble focusing on work. 1. Increased risk of accidents. Daytime sleepiness can increase the risk of accidents, both at home and at work. For example, people who drive while drowsy are at greater risk of falling asleep at the wheel, which can lead to serious car accidents. Similarly, in work environments, drowsiness can contribute to accidents in construction, factories, or other places where attention and caution are required. In summary, insufficient sleep can have a significant impact on memory and concentration, negatively affecting academic, work, and daily life performance. It is important to prioritize adequate sleep and adopt healthy sleep habits to maintain optimal cognitive function and good performance in daily activities. Subscribe to our channel and start your journey to a better life. Here you'll find inspiration, practical tips, and constant motivation to achieve your goals and become the best version of yourself. Don't wait any longer to take the first step toward positive change. Join our community today and let's make each day an opportunity to grow and thrive.